Welcome, everybody, to our compliance briefing. My name is Brian Feeley. I'm the Senior Vice President of Marketing for Corporate Synergies. And joining me today, probably no stranger to many of you who have been on these live briefings, our very own rock star, Dan Kuperstein, our Senior Vice President of Compliance and our ERISA attorney. Thanks for joining, Dan. And a very special guest today joining us, a seasoned professional in the world of employee benefits, our Regional Vice President out of beautiful, sunny, and sometimes rainy Orlando, Florida, John Kern joining us. John, welcome.
Thanks.
So lots to cover today, and we're going to be talking about full transparency, right? We're going to be talking about the transparency rules, no surprise billing. We do know that, there's so much to cover. Dan, earlier on, you were talking about the fact that there's probably well over 1,000 pages of small print related to the legislation and all these initiatives that are going in. But we're going to break it up into three main components. We're going to focus on, back in fall of 2020, what the government agencies issued, and that was the major regulation on transparency in coverage rule. Okay, we're going to cover that. Second, we're going to talk about the legislation to prevent no surprise medical bills. One I'm a big fan of. So the No Surprises Act, or NSA. And then third, we want to make sure that we cover, there's these other transparency related initiatives that were signed into the Consolidated Appropriations Act of 2021, the CAA. So Dan, why don't we get started with you? You don't have to take them all at once, right? It's a lot to cover, but why don't you give us a little bit of a background on where we are right now as it relates to those three big initiatives?
Sure, yeah, and I'm not going to talk about all of those things all at once, so I think it's probably easiest just to start with the most recent thing that happened, which is that, last month we got some new regulations, and it's called an interim final regulation, but it's some new regulations on the NSA, the No Surprises Act that you mentioned, and that's really the most recent thing that we got, and that's kind of really brought all of this into everyone's attention recently. But this, you could probably say, all of this stuff kind of comes together. It's part of kind of like a big storm of regulation, really. So let's talk about that. So the most recent development here happened last month. The government agencies that were implementing the NSA, right, which is designed to prevent surprise medical bills, they issued these new regulations. And just to give some background on what the NSA does, it provides different provisions. With certain exceptions, they put a ban on surprise medical billing. For emergency services, number one. Number two, they ban high out-of-network cost sharing for emergency and certain non-emergency services. And then they ban out-of-network charges for ancillary care at an in-network facility in all circumstances. And then finally, they ban other out-of-network charges without advance notice. And so, among other things, these new rules, they require plans to provide patients with advanced explanations of benefits before scheduled care. They establish plan ID card criteria. They establish certain plan continuity of care requirements for certain patients. And I think importantly, for what we'll be talking about more probably a little bit later, is they create an independent negotiation and arbitration framework for settling pricing disputes. And that process is generally called the IDR process, or Independent Dispute Resolution process. And that's a big part of what the NSA is all about. It's really designed to try to hopefully lower some of that litigation that's out there about billing disputes. And all of these new NSA rules go into effect for plan years beginning on or after January 1 of 2022. So that's the recent development, but there's obviously a lot more here.
Well, that's the recent development, and there's more. Oh, great! Yeah, we're going to be here 4 hours.
Yeah, exactly.
Let's circle back to the big word transparency for a second, because I know that transparency probably means a lot of things to a lot of different people. And John, you're in the field and you're talking to clients every day. What are we talking about as it relates to the word transparency? Can you help us out with that a little bit more?
Yeah, Brian, I'd be happy to. I mean, I think the biggest part of this rule, including the surprise billing and the price and cost transparency, is to help become more published the rates and the cost for individual care that an individual may be receiving, what they're paying for when they buy the insurance, and how they make more informed decisions. So as Dan said, very, very large bill, very cumbersome. So we'll be looking forward to talk about this more as we process through this show here.
When you're talking to clients, I mean, as Dan already mentioned, these are real regulations. This is a real law. There's some, responsibility on the part of the employer. What are what's the practical impact on the employer as it relates to these? What kinds of conversations are they having with their vendors and their partners? Because this sounds like it's put squarely on their shoulders at this moment.
Yeah, Brian, and it really comes down to several different facets, whether you're fully insured or you're self-insured. If you're fully insured, most of the responsibility will fall on the carriers to make sure they're compliant with the law. But there's such depth to this bill. For example, ID cards are all going to have to be administered. They have to include deductible out of pockets for both in and out of networks. There's more accountability for the carriers to publish active directories. There's requirements that are holding the carriers and the physicians responsible. We talked a little bit about the IDR, the independent dispute resolution. I think that is a huge topic that we need to be discussing with all our self-insured clients. Who's going to take that responsibility? What you go out with the rates, and then just look at the expected cost increase. And speaking to one of the carrier partners the other day, to quote, "This bill is very expensive, very extensive, and very cumbersome." So that leads me to have some concerns. But to start, that's just a preliminary outline of the changes that are forthcoming for our clients and for plan holders.
Yeah, and I would agree with that. I think just some kind of good takeaways. Two big things that I think all the employers and plan sponsors out there should be really kind of keeping in mind as they go forward, talking about these things with their carriers and plan vendors that John touched on. Is one, right? The heavy lifting here of getting the plans into compliance is going to have to be done by the carriers and TPAs. Since which obviously is more of a responsibility for the self-insured plans out there, since those entities have more access to all of this medical information and have more direct interaction with the medical providers, like the hospitals, medical practices, things like that. So you can't really go it alone here. So that's, I think, the first big takeaway, right? You got to work with your plan vendors, work with your carrier, work with your TPA, especially for a self-insured plan. And then the second big takeaway, kind of what John touched on as well, is that, look, there's just so much out here, right? 1,000 pages, right? Even though we're so close to this compliance deadline, NSA of 1/1/2022, it's important to understand we still haven't even received all of the NSA regulations yet. We've only received part 1 of 3 sets of regulations under the NSA. Part 1 was issued just last month in July. So here we are, right, trying to get ready for this next, renewal cycle, getting ready for the renewal season for January 1. And we just basically last month, right, just got those regulations. So it's almost like plan sponsors have to get out there and start taking action on things that haven't even happened yet. And that leads to a lot of uncertainty, and it's one of the, another big takeaway that's going on here.
Dan, that's a broken record as it relates to any regulation. I mean, every time we're talking about a big issue, it's funny to me that we always get to the point where there's some regulations that are out there, but we're still waiting on some final, guidance on things. It's like, hey, that's just the normal day in your world in compliance. But John, anything to add to that?
Yeah, the only thing I'd add again, as a consultant, our biggest concern right now is this IDR, right? Mm-hmm. We look at the arbitration style, baseball style arbitration, there's a winner or loser. The conversations we need to be having with our TPA and addressing our out of network reimbursement, defensible go out rates and really plan designs. We need to start having those conversations. And as alluded to, we don't have answers yet. And speaking to the carriers and the PBMs, we're still in a wait and see. But taking the takeaway from my call last week with a major carrier partner saying it's very expensive, that has me a little concerned. So I'm imagining that means an increase. So we'll have to see this through and as quickly as we can and start getting answers for everybody.
So as we always say, more to come on this, more guidance to come down the road. Let's move to the second issue that we wanted to cover, and that is the transparency of coverage. So this coming out at the end of the Trump administration in 2020. if you could, maybe let's start, Dan, with a bird's eye view of transparency of coverage, if you can.
Yeah, so I think transparency has always been a major component of the Affordable Care Act, that we've had for a decade now, right? This current storm of transparency regulation that we're currently going through really got started for health plans and employers in starting in the fall of 2020, when the DOL, HHS, and IRS started to boost the transparency requirements that were already in the ACA and issued these transparency and coverage rules. It's really just one set of regulations called the Transparency and Coverage Rule. And under that rule, group health plans and insurers have to, first of all, upon request, disclose certain cost-sharing information about the plan, like co-insurance, copay information, for example, to participants and beneficiaries and enrollees. And then secondly, they have to disclose in-network provider negotiated rates, historical out-of-network allowed amounts, and prescription drug pricing information to the public through machine-readable files posted to a website. And those requirements I just mentioned, those two requirements of the Transparency and Coverage Rule, go into effect for plan years beginning on or after January 1 of 2022. But much of the heavy lifting for those requirements is really going to be occurring, now and during this current year's renewal season for that 1/1 plan year. And so really we'll have to be looking at this during the current service agreement negotiation cycle, which really has already started. And then also in this transparency and coverage rule, we've got additional disclosures, which are disclosures of cost estimates for different types of covered medical items and services that are made available to plan participants. They have to be made available to plan participants on an internet website. And so plans and insurance carriers are required to provide estimates for an initial list of 500 items and services beginning on January 1 of 2023. And then all of the required items and services in these regulations, which is a lot more than 500, must be available by January 1 of 2024. So a lot more to come even in this transparency and coverage rule that really got started back in the fall of 2020.
Great idea. Love it. Yep. Full transparency, but it sounds like a lot of work and responsibility, as I said in the beginning, on the part of the employer plan sponsor. So, John, as I said before, you're talking to clients, you're talking to carriers, but from a client perspective, what are they doing to ensure that they're going to pull all of this together to be compliant? It's a lot to think about.
Yeah, and again, it's a fluid situation, and as we said earlier, a lot of the responsibility, if you're fully insured, will fall in the hands of the carriers. However, if you're self-insured, it falls in the hands of the self-insured. And we're also, as we alluded to, the PBM, the pharmacy benefit managers, transparency, looking at the cost, who's using the prescriptions. We're seeing the PBMs take a pretty good lead on that. But there's a cost associated that we're still waiting for more answers. But again, compliance, if you're self-insured, will fall back on the self-insured plan holder and fiduciary responsibility. Okay.
So again, more guidance to come on certain things. If you're self-funded, a lot to think about and start pulling together. If you're fully insured, then a lot of this is going to fall on the shoulders of the carriers. But there's still more. Okay, so we talked a little bit of transparency, but what about those other transparency initiatives that were covered under the CAA, not the NSA?
Right.
So as not to have the CIA or FBI coming after you.
That's right. I'm glad you're getting all the acronyms right.
Yeah, I'm trying.
There's a lot today. And the agencies, actually, technically the FBI is not one of those agencies, but good try.
You never know. Maybe the guidance will come out and they will be.
Yeah, exactly. So definitely. So DOL, HHS, and IRS are the main agencies doing these things. But anyway, the third piece of all of this separately is that employers and plan sponsors also have to comply with these other CAA rules, which were not in the NSA, as Brian mentioned. And this includes many new transparency and disclosure requirements that already went into effect earlier this year and will be going into effect in 2022. Among other different requirements, there's a prohibition on what are called, effective January 1 of this year, 2021, there's a prohibition on what are called gag clauses, or provisions that are in plan administration and service agreements that restrict those parties from disclosing specific price or quality information. And that's mostly something that falls really on the TPAs out there. There's also certain mental health parity disclosures, which are required to be disclosed if requested by a government agency. Those rules went into effect beginning on February 10th of 2021. We've been talking a lot about those in some of our webinars and things like that. And really that's only required of self-insured plans. And for the most part, we've seen the carriers and TPAs really provide those for most of the clients out there. So that's the stuff that's kind of already happened. And then we also have seen a big part of this are these new ERISA Section 408B2 disclosures, which are requirements that covered service providers, including brokers and consultants like ourselves, make certain disclosures of their direct and indirect compensation that are above $1,000 received to a responsible plan. They have to be disclosed to a responsible plan fiduciary. And these are annual disclosure requirements that are effective December 27th of this year, 2021. And the disclosures have to be made reasonably in advance of each renewal or contract extension. So that's a big requirement, really on us and on those responsible plan fiduciaries of our clients.
Yep. And again, as I kind of alluded to earlier, let's not forget about CAA, right? The mandatory drug price reporting, machine readable, and all the things associated with that. And again, the annual disclosure, so it'll be due June 1st of each year following that. So a lot to come here, a lot to come.
So we kind of did almost a 180 where we were focusing on, okay, this is what the employer and plan sponsor needs to be concerned about. Now we're talking about disclosures regarding this transparency on the part of the broker and other partners and what have you. Maybe if you don't mind taking us through that a little bit, what does that look like? What do the disclosures look like on the part of the broker, if you could, Dan?
Yeah. So that's definitely something that really hits close to home, obviously, and something we've been doing for a while now. But the CAA amends ERISA fee disclosure rules that are in Section 408B2 of ERISA that currently only apply to retirement plan service providers. And now, as a result of these rules, they will begin to be applied to brokers, consultants, and other service providers of health and welfare plans, which is the major change that's occurring here. And there's really 9 broad categories of required disclosures that are very similar to what retirement plans have to do, describing services and compensation, both direct and indirect. And these disclosures must be made about all group health plans being brokered or consulted on, including dental, vision, health reimbursement arrangements, HRAs. But the key part to all of this, the thing that's really, I think, that's a big change for the industry is that you also have to report what's called indirect compensation. That's a key part. And it's one of the real reasons that this rule was issued. And that indirect compensation is generally defined as any amounts that are received from anyone other than the plan or the employer plan sponsor. For example, like where a broker receives compensation that's not in the form of commissions from a TPA or an insurer providing services to the broker's client. And really the big problem here was that a lot of health and welfare plan brokers in our industry were receiving very large sums of money, sometimes in the hundreds of thousands of dollars a year, from third-party service providers that provided services to these brokers' clients, including fees from consortiums, wellness plan providers, and others. And this kind of indirect compensation was just going undisclosed for years. But now, as a result of this new rule, they're going to have to be disclosed. And that's a big reason why that it's being done. Unfortunately, I think I definitely am very proud to say that for well over a decade, corporate Synergies has been disclosing all of its direct and indirect compensation on its brokerage and consulting service agreements. And it's something that has always really impressed me about this organization since I started working here 7 years ago. And basically CSG was looking at what was happening with retirement plans and made disclosure and transparency a priority very, very early on, and has continued to do so.
And Dan, I agree with that 100%. We've been impressed, and I know our clients really appreciate when we outline the scope of services we provide and the transparency in our fee schedule. So thanks, and kudos to you and your team for doing a great job. So
that would be great if this were only about corporate Synergies clients. However, for those on the call that are not working with corporate synergies, let's just say for an example here, that they're not able to get the disclosures, that they're not able to get the information. So what happens in that case?
Yeah, so that's the big kicker here, because if the disclosures are not provided from the broker or consultant at the time of contracting and reasonably in advance of each renewal or extension by the broker or service provider, then the plan fiduciaries of each employer plan sponsor must take a series of actions, including ultimately notifying the DOL and terminating the service provider in order to avoid a prohibited transaction. In case you're not all familiar with that term or with ERISA, that's a prohibited transaction that's not a good thing under ERISA, as that can result in major liabilities and legal fees for the employer and its plan fiduciaries.
That's how I'm compensated. So I better look into that prohibitive transaction.
Prohibited transaction. Yeah, that's not a good thing.
No. All right. So what about, with some of these guidances, there's always some exceptions to the rule. Or if you're an employer, are you looking at, can you provide some examples of where there may be some exceptions that they should be aware of?
Yeah, there are some exceptions and exemptions here and there. For example, for certain types of plans like travel insurance plans and expatriate coverage that are exempt from some of these rules. Travel insurance, for example, is exempt from the NSA. But the big thing that I believe, many organizations in the health insurance industry are really looking at very closely right now is some kind of enforcement relief. And specifically what I mean by that is, since so many of these new rules were just released this year, and in some cases just last month, like we just talked about with the NSA, and since so many are still yet to be released, and since we're currently in the renewal season for 1/1 of 2022, and we need to act on these rules now, there's virtually no time, right? There's just no time for most plan sponsors, employers, and even insurers really to get everything 100% set up, including, the reporting and the disclosure systems, the disclosure websites into place. And, and on top of all of that, just this medical cost information isn't something that, like we talked about earlier, most employers and plan sponsors just don't have access to all of that anyway, right? Since it's all just sitting on the carrier and TPA side. So based on everything we're hearing out of Washington, there may be, and I'm going to knock on wood here because it's not a guarantee of any kind, but there may be some kind of grace period or some kind of non-enforcement period where the agencies say, look, we're not going to impose fines and penalties for failure to comply for this first year.
Yeah. So we saw that before, if I'm not mistaken, with information reporting and its many different iterations and guidances as it came out, and extensions and exemptions and what have you. But this is all happening very quickly, right? So all of these things that we're talking about, I think it's important for employers to be very aware as guidance comes in. What's the short-term responsibility? What do they need to know? Any sense of what the long-term, what the expectation is for employers as it relates to long-term? Where's this all going?
Yeah, and I think just from the legal and compliance standpoint, I'll start. Maybe John, you can kind of weigh in, but from my standpoint, after any kind of enforcement relief that we might get, like you mentioned, like we saw with the ACA, at least during the Biden administration, we're expecting that these plan transparency rules will be an enforcement priority for the agencies, those agencies I mentioned earlier, DOL, IRS, HHS. Mm-hmm. Since that was made very clear in the president's recent executive order issued last month on promoting competition in the U.S. economy. So it should also definitely be a priority for any employer, obviously, sponsoring a health plan, and make sure that it gets into compliance and really looks closely at its service provider agreements to make sure its carrier or TPA partners are putting these disclosures together and really making them available. So that's my take. I would say in the long run is that at least during the Biden administration, at least for the foreseeable future of the next 4 years, even if we get non-enforcement, it will be a big priority, enforcement priority for President Biden and the administrative agencies.
So that's your view from your area of focus and what have you, long-term expectations. Now, on John's side of the fence, John, as a broker-client relationship and the things that are going to implicate really the work that gets done between the broker and the client. Where do you see that in terms of long-term implications for all the things that we're talking about?
Yeah, I think, short term, it's going to be painful. It's cumbersome. There's a lot of new requirements. Long term, I think price transparency is going to be a really good thing. I think eliminating some of the outlying billers that occur in ER, anesthesiology, air ambulance, things of that nature that are occurring in a hospital setting, in a bundled bill setting. I think there's going to be great opportunity. I think there's going to be more pressure on the delivery system itself. I think you're going to see narrowing of rate differentials from hospital A to hospital B. And based on the government's involvement, I think some of those outlying hospitals too, we should be seeing some price reduction in those areas. Also feel that there may be more of desire to co-manage, and there's going to be more reference pricing outside the network that is going to align more synonymous with all the facilities in the surrounding area. So I think long-term, there's going to be a positive impact on this from a pricing transparency and hoping a reduction of cost.
What about from a participant's standpoint? I can't help but still get burned over the fact that I had a bill that came in when I had a stress test. You've heard me say this before, Dan. And of course, the treadmill that I was on was this piece of equipment that was rented from outside of the network, and we got charged for it. And I'm still burning to this day that happened. But anyway, all of this transparency, all of these new regulations, we just talked about long-term positive, right? It sounds like, talk to me about, participants. Maybe John, you go. As a participant, what is it that we look forward to as a consumer of benefits? How does this help us and make us better utilizers of our benefits?
Yeah, Brian, it still comes down to, I think, education and communication. I mean, a lot of the carriers have pricing tools, but we're just not seeing the members utilize it. So I think it's important to continue to stress that. I think there'll be more spotlight on the transparency and hopefully educating the consumers to seek, quality of care and care that is at the best price for their treatment plan. But I think it really comes down to empowering and educating consumers and helping them make informed decisions for them and their families.
How about you, Dan? What's your thoughts on that?
As much as I love John's response, and I think that that's true, especially if you're with a great partner like Corporate Synergies, and we can do all the great communications to help your participants understand what's out there. I think that's certainly, one of the optimistic things about this.
Dan's going negative. I hear it. I hear it coming. Here we go.
Exactly. I'm going to take the pessimistic view, especially since we talked about that really expensive treadmill.
Glass is half full, Dan. Glass is half full.
Exactly. So if I'm taking the more pessimistic view here, I think that, look, we've had the ACA transparency rules going back over a decade. We've had consumer-driven healthcare rules for even longer, right? Designed to make it easier for consumers to have more choice and make it easier for them to shop around. But really, healthcare costs have continued to go up significantly for both participants and employers over the last decade. And while the ban on surprise medical bills in the NSA is certainly an important step forward for reducing surprise medical bills, and while the arbitration procedure outlined those rules is certainly going to help employers and plan sponsors deal with those billing disputes in a more expedited manner and reduce the likelihood of expensive litigation, right? There's still a lot of exceptions and exemptions into those rules, and it's still possible and that plan participants are still going to get a surprise medical bill on occasion. They'll still complain about them. They'll still get an expensive treadmill somehow along the way. And so it's important really to be aware of that as well, that as much as you can do things now to do more communications and get the word out to participants and everything else, right? We've kind of seen this before, right? We've seen it, for over a decade now, and, healthcare costs just keep going up. So.
Yeah, pessimistic view. There you go. Well, let's end on a half glass full or glass half full way to end this, because I think that we covered a lot. And I want to thank you, Dan, and I want to thank John, our special guest today, for giving us some additional insight as it relates to this. Dan, why don't you close us out, because I know that there's more to come on education and these great topics that we have and some of the resources that I know Heather put in our chat.
Definitely. Thanks, Brian. And just as a quick plug for our next webinar, which we'll be talking about all these different developments, including surprise medical billing and transparency. Come out to that. It's called our quarterly benefits compliance review webinar. It's going to be on September 14th. There's also a link in our chat to sign up for that. And then finally, if you can get the recording for this briefing and stay up to date with this and other benefits news by visiting our Hawk website, which is our Hawk LinkedIn group, I should say, spelled HAWC. And then a link to that's also going to be available in the chat. So hope you can join us for more things coming up soon. Thanks.
Great. Stay cool, everybody.
Thank you.
Thanks. Thank you. Thanks, Brian.
Thank you, Brian.